This week, we're taking a look at one of the most controversial issues in men's health, prostate cancer screening and treatment. An estimated 240,000 Americans are diagnosed with prostate cancer every year. Almost 30,000 die, making it the second leading cause of cancer death for men.
Current screening guidelines say men over 50 can consider being tested for prostate cancer. Screening is not recommended for men older than 75. However, a new report in the Journal of the American Medical Association says that as many as 40% of men over the age of 75 are still being tested. So, John, are doctors over-ordering or are patients over-requesting?
It's a little bit of both, and I think this is one of the most confusing areas in all of medicine for both doctors and patients. There are two main reasons. One is, yes, there is a test that we use to screen people for prostate cancer. It's called the PSA, prostate-specific antigen. The problem is it does rise when you have prostate cancer, but it also rises in a lot of benign conditions, like just your prostate getting bigger with age, and also if you have inflammation of the prostate called prostatitis. The second thing is that even if you do have an elevated PSA and you get a prostate biopsy and it shows prostate cancer, the odds are you're not going to die from prostate cancer, because it's such a slow-growing thing. Usually takes at least 10 years to kill you, although there are exceptions to that. I've had a friend who's died quickly from it. So 16% of American men will get prostate cancer in their lifetime, but only 3% or so of American men will die. So more than 80 of the prostate cancer, so more than 80% of the people who get prostate cancer don't die of it. But now, here's the thing. 30,000 people, as you say, die of prostate cancer each year. So what do you do about them? How do you prevent them with some kind of screening test and algorithm without over-testing and over-treating? And that is what David Agus is going to tell us how to do.
I mean, come on. It's a crazy, crazy argument because they kind of lose it all. So when you start to look at the data, since we started screening in the United States, death rate is down by 45%. Countries that screen have half the death rate of countries that don't. At the same time, we dramatically overtreat this disease, so it's both. So I do PSA testing on all men, irregardless of their age, as long as they have at least a 5-year life expectancy. But there are many patients when we do a biopsy and it's got a very low-grade cancer that I know is not going to cause a problem, which is about 40 to 45% of them, we don't treat. We follow them and do a repeat biopsy. We call that active surveillance. So don't throw out the baby with the bathwater, or whatever that expression is.
If these tests actually work, why are we still arguing about them?
Because we were looking at it a public health perspective. And when they do randomized trials and they say, listen, you get tested every year, you do whatever you want, let's see who lives longer, there is not a dramatic life extension. The problem is people do whatever they want. Most of them get tested anyway. And this is a long course disease.
And the other thing, Anthony, is that in one big study that blew us all away in 2009, over 1,000 men had to be tested and 48 men unnecessarily treated to save one life. Now, I guarantee you, if you have that one guy who was saved sitting to the left of me, there's nothing I'm going to say that says he shouldn't have been treated. Those 48 guys who were unnecessarily treated and may have erectile dysfunction and other problems, they're going to think differently.
No question.
You're saying that you do give it to men over 75, but I'm just curious. A lot of this research shows the cost is in the follow-up procedures, and there's also an emotional toll on these men. But you're still saying, like you said, the baby, you can't throw out the baby with the bathwater.
Well, listen, I agree with you 100%. I think we need to change the words. So low-grade prostate cancer, take out that word cancer. Let's just call it a low-grade prostate condition. And then you're going to take away all that emotional stress. I tell you have cancer, even though it doesn't need to be treated, it is stressful. But the other side is, I look at two people in the eye every week and I say, I've got no more drugs to treat your cancer. I don't want to do that anymore. And so if I ask them, I'm going to throw out screening, they're going to hit me in the head.
And one of the big problems why a lot of doctors still prescribe it to get the PSA in people over 75 is, the thinking is, okay, you need to live at least 10 years in order to benefit from it. But there's no expiration date on people's foreheads. You don't know. Maybe that person will live to 100. And so that's the problem. How do you know who to treat and who to screen?
I may not have a prostate, but this is a fascinating conversation nonetheless. Dr. David Agus, Dr. Jon LaPook.
I agree with your statement, by the way.